What's going on, everybody? My name is Dr. Rob. This is Straight Talk Psychiatry, and we're going to do a segment called Rob Reviews, and we're going to see how that goes. And today we're going to review Wellbutrin, comments, questions, things that we've seen over the last handful of months. A lot of similar questions pop up. And not only that, we see a lot of the same questions pop up in clinic. And instead of just replying to just a single person's comment or question, we figured we'd put it out here for everybody to see so that everybody can learn. So we're going to see how that goes. Today, I was going to do five questions and comments, but then we had a really interesting question that popped up in just a couple days ago. So we're going to do a bonus 6 question here at the end also. Quick disclaimer, pretty much anything that we say, we really want to give you a good foundation, general medical education, good information for you to be able to go talk with your doctor about these medicines and how they're affecting you or how they could help you, or if you're afraid of them or scared of them, why you might not be wanting to go forward with one medication versus another. Please take all of our information with the understanding that these medicines and these educations apply to each individual differently. So you have to go to your own prescriber and provider for the best path forward for you. With that being said, let's get to the first question that we have here. And that is from Valerie Mora. She says, hello. I was recently prescribed 150 for weight loss, 150 milligrams of Wellbutrin for weight loss. I'm extremely fearful. I've had a horrible experience with antidepressants in the past. I'm currently on Cymbalta 40 milligrams, going on 5 years. I've gained 60 pounds. Does it help with weight loss? Is it worth the risk? Very legitimate question. I'll be honest, as far as Wellbutrin being a medication solely for weight loss, it's not really intended for that. Wellbutrin does have the side effect of weight loss if you go through the side effect profile, but the weight loss is not necessarily the weight loss that you're looking for when you are trying to lose weight. Sometimes prescribers or providers will mention that, hey, by the way, you might lose some weight with this, but it was probably, I'm kind of reading between the lines there, that it's probably more so mentioned, not necessarily for the purpose of weight loss, though. To kind of show you the side effect profile, I'm also going to routinely go through the same mechanism that I do with patients when they're in clinic with me. And I use drugs.com. So we're going to jump over to drugs.com. And if you type in any medicine, doesn't matter, any medicine, any supplement, they will give you a very good rendition of what the medicine is, when it came out, what it's used for, FDA approvals, not just the approvals, but then what is used off-label. And we're going to focus on the side effects. So for Wellbutrin and side effects, and pretty much any medicine, when you go on this page, you're going to see this massive list of side effects, and it can be kind of daunting and make people very nervous about it. Take what you see here and apply it to yourself individually for sure. There's many small side effects that people will have noticed. And as you go down the list, and if you're on this medicine, you might be able to attribute some of the things that you felt for weeks or months or years to this medicine. But down through here, eventually, let's see here. Let's see if we can find it. I know it's down here as far as under metabolic. Metabolic, very common, which means 10% or more. Weight loss greater than 2.3 kilograms, roughly 5 pounds, and weight gain greater than 2.3 kilograms, up to 11%, weight gain. So people will lose weight and gain weight with this medicine, but roughly 5 pounds, maybe somewhere between 5 and 10 pounds. It is not going to be 60 pounds though. So if the purpose that you are looking for is weight loss, I definitely would recommend that you go back to your provider to have a discussion about other options that could be good for you as far as weight loss. There are medicines that are actual supplements or supplements over the counter that are useful. There are low grade type stimulants that are useful, like phentermine. Um, but I would not imagine that Wellbutrin itself would help you lose 60 pounds. But if you're seeing this, comment back. I would be curious to see if you did see a substantial weight loss. Let's go over to the, oh yeah. This is Big Bulls. Big Bulls here says, this stuff works great for my chewing tobacco and anxiety for a while. Unfortunately, he had the side effect of a very high sex drive, and it was out of control. And my girlfriend made me quit. Because I wanted sex at least twice a day, every day, sometimes more. It kind of worked like Viagra for me, and it got to be uncomfortable even for me. Uh, I admit that is not the type of robust side effect that I've seen from other patients. I do know that is a side effect. You can have an increased sex drive, and that is why often Wellbutrin is added on to other SSRIs to help with a sex drive, to help with low libido, to help with just sexual dysfunction in general after you've been on an SSRI and you notice sexual dysfunction side effect from an SSRI. My wife has a good little series on sexual dysfunction from antidepressants, and she talks about that one specifically. Even in her video, I don't think she definitely talks about it, but I don't think she's given quite the robust props to this medication for that type of an effect. And clearly going a little overboard and bringing him to the point of needing to discontinue that medication. So I brought this one up just because there are, when we talk about side effects, weight loss was one of them, but then an increase in sex drive, which many people struggle with on antidepressants. Side effects can be sometimes a good alternative. We will, yeah, that's pretty interesting. Not typical, but definitely happens. Let's jump over to Colleen Carey here. I have been on Wellbutrin for 7 days. I've noticed the difference in one day. Honestly, the medication saved my life because I did not want to live. That's pretty profound. And I'm glad that medication helped you so robustly. I picked this one out for 2 reasons. 1, because these medicines can help. 2, because there is at the top, back to the Wellbutrin side effect page here. Put that back up. At the very top, and they put it in a black box here. There's a black box warning on Wellbutrin, specifically about suicidality and having risks, having an increased risk of thoughts and actions of suicide. That is relatively low and an uncommon thing, particularly because when we give people this medication, we expect the opposite, right? We expect to see an improvement of symptoms, not a worsening of symptoms. And this person found a positive result quickly with just a handful of days, noticing the difference. Many times the providers, doctors, whoever the prescriber is, will tell you, hey, with any antidepressant medication, you have to wait usually at least 2 weeks, but closer to 4 weeks to really see a good, robust response in our overall mood. Because a lot of feel good from starting any medication can be placebo effect with these medicines. This person felt it right away. Is it truly placebo, or is it really this person feeling better? Well, I, I wanted to bring that point up because people will often notice side effect right away with these medications. And so side effect as far as, well, maybe I'm super anxious, maybe I'm not sleeping very much, maybe I've got too much energy and feeling shaky. People will feel that right away. And so it's having an effect on the body, but it can equally help you quickly. But don't discourage if you're not feeling it right away, because it does statistically take 2 to 4 weeks. This next question is Brooke Harris. Do you know if it plays a role with intracranial hypertension? It would make sense due to an increase in blood pressure. That was a really interesting question. The short answer is no. The little bit longer answer is there are a lot of people with high blood pressure. High blood pressure by itself does not increase the risk of intracranial hypertension. When we measure blood pressure, we are measuring the pressure inside of your arteries. When you go to the doctor, you put that cuff around your arm, that is the pressure inside of your arteries at that spot, at that location in your arm. When we talk about intracranial hypertension, that is the pressure of the cerebrospinal fluid around your brain and around your spinal column or spinal cord. And that is something totally separate. In order to measure that, we look at, or to see evidences of that, we look at the back of the eyes, or to really get the actual pressure, you have to do a spinal tap. So you put a needle into your spine, and then we measure how much of that spinal fluid pushes out, and we can measure the level of that pressure. Not the same thing though. If your blood pressure happens to go up and you happen to have intracranial hypertension, those are separate entities, separate things. But then you made me question myself there, because I thought, well, maybe there was a side effect with Wellbutrin that I didn't know about, or an uncommon side effect with Wellbutrin that could have caused intracranial hypertension. So I went back to the side effect profile. Again, this is literally what I do with the patients in the clinic. I go through this with them to get them the best answer that I can give them on the spot. I went through all of these possible side effects: nervous system, metabolic, gastrointestinal. Let's see if I could find. I believe there was a neurologic. I thought there was something different than just the nervous system. Nope, this is where they would have put it in at. But a lot of this under the nervous system, talking about seizures, which seizure is a risk of Wellbutrin. We talk about that in my wife's video on Wellbutrin. But nothing in here, even when you come down here in post-marketing reports, no evidence of intracranial hypertension that has been found or reported to the companies. Now, with that being said, the other important part of this question that she was asking is, we got all this evidence here on these side effects from drugs.com. That doesn't mean that it can't happen to you, that it doesn't mean that it's impossible not to happen to you. But boy, is it going to be really, really uncommon to have intracranial hypertension from Wellbutrin with no evidences placed on a resource like this. So hopefully that helps answer your question about any relationship between high blood pressure and intracranial hypertension. Let's see here. Is that Zayla Blue? I hope I didn't mess that one up. Wellbutrin works good for me. I have weight I have weight gain and ringing, but I'm worse off without it. Two parts there. One, weight gain and ringing. I assume ringing in the ears. Weight gain is, as I went through with the first comment there, it is a side effect of Wellbutrin. It's just many times more common to see people lose weight, not necessarily gain weight. But as you're feeling better, sometimes people eat a little bit more and then gain weight. If it is a weight gain, again, it doesn't seem to be too much. They hold that 3 kilograms, roughly 5 pound weight loss and weight gain. So you're not talking about a substantial amount of weight gain or weight loss when you're talking about this medicine. But then she says, but I'm worse off without it. And that kind of hallmarks the point of any of these medicines that we are prescribing to people. There are risks and benefits of pretty much anything that we prescribe, and there's risks and benefits with any medicine that you take over the counter. My favorite quote from one of my favorite pharmacists is that when we're prescribing medicine, pharmacology is controlled toxicology. Pharmacology is controlled toxicology. And that's just to highlight the point that we are looking for benefits from the medicines that we prescribe, right? We only want good outcomes. But there's a litany of not so good side effects. And then you have to take that risk and benefit teeter-totter, and you have to say, well, is this medicine, even though I'm getting some side effects, am I still better off with it than without it? And then for Zala Blue here, the answer is clearly yes. We're better off with a little bit of weight gain ringing in our ears than we were without it. And that's an encouraging thing to see from Miss or Mr. Blue. And then we got one more question that I wanted to highlight here. And that one was from Paul Tracy. And this was the one just a couple of days ago that we got in the comments section. And Paul was saying, I have been on this medication for several years. I'm depressed, and this medicine helped me with my crying and my mood swings. I just don't feel happiness. We've gone up and we've gone down on the dosage. I just don't think it's working for me. Besides talking to my doctor, any suggestions? And I do. Again, this is kind of reading between the lines of such a short comment, but we see this comment. I see this comment relatively frequently, and there is a difference between pathology and us not being where we want to be. So if you consider like this being the neutral, the baseline, this is where everyday life happens, and you come to see us because you're down here, and that's pathology. This is where anxiety happens. This is where depression happens. This is where the diagnoses occur in the clinic. We want to get you back up here. We don't want you down here. We want to help you get up here. And between a combination of therapies and medications, hopefully we can do that. But what Paul said there, I thought was very fitting. And when I ask people in clinic routinely, they will generally agree with this. There is a difference between pathology and happiness, right? There is a difference between being down here and being up here, being happy. And that happiness is usually revolving around fulfillment. These medicines aren't going to change your life as far as where you go to sleep every night. It's not going to change the relationships that you have with everybody around you. It's not going to change a lot of the framework of your day-to-day life from the time you get up to the time you go to bed. Hopefully it'll help you conceptualize better and reason better, but it's not going to elevate you to that level of happiness. Finding happiness and finding that fulfillment comes with a different type of work. And that's where you see a lot of people get coaching, or that's where you see a lot of people turn to books and events to help find that fulfillment, because there is no pill for that fulfillment. Um, my wife and I, hopefully, I know Allie sees this relatively frequently as well. We're looking, okay, I feel better, but I want to get to that next level. So my wife and I are trying to implement an aspect of that into what we do, into practice, or coaching in general. Um, because you don't see that sort of stuff from doctors very often. And you hear comments from people that, well, doctors don't really care. They just care about, keeping you sick, or they want you to return and continue to give them copays and everything else. I can tell you that is not true. We want you to not only improve, we want you to get out of any pathology that you have. We want you to succeed and feel good about yourselves. But the system is not necessarily set up to help you get to that level of fulfillment. So hopefully we can produce something that helps people like that in the future. And that was a whole lot of me tearing somebody's life apart based off of a couple of sentences. And maybe I'm right about that, maybe I'm wrong, but boy, I hear that a lot. I hear that a lot from patients. And by the way, I didn't even mention I'm a family doctor. I'm a family physician. I work in an urgent care, or an express care, or a quick care, or whatever type of clinic you want to define that as. I don't have a patient base, and I still see a ton of people come in with anxieties and depressions, and they're on medications. And is this a side effect? Should I stop this medicine? Because they feel like they don't know where to turn, and they tell me those things. They mention, well, yeah, this medicine helped me stabilize, but I want to feel good. I want to feel happiness. So again, Paul, Tracy, I hope I gave you some bit of a insight as to um, where to go with that. Finding happiness, finding fulfillment in your life. That's a different level of work. That's going outside of your comfort zones to find new things that help you drive you, help get you out of bed, and give you excitement in the morning. But that takes a lot of one-on-one work and a lot of trial and error. So yeah, that's kind of the 5, 6 comments that I wanted to talk about today. Let's see here. I do have we got a couple questions on the side here that I'm going to read through real quick. Oh, my wife linked the antidepressant miniseries, antidepressants and sex miniseries in the comments section, if that is helpful. Pop this up real quick. Tubo 1812. Hey doc, how to manage increased blood pressure? Question mark. I imagine that's generally how do we go about managing increased blood pressure in relation to an SSRI? Is it with Wellbutrin? Hey, I started taking Wellbutrin. My blood pressure is going up. What do I do about that? This is a very specific question that needs to be discussed with your provider. But generally, when people come to see me, it's kind of to the degree of what is that blood pressure, and how serious were our symptoms before we started taking Wellbutrin. Kind of back to the point over here. Let's find the right one here. Was it this one? Or this one, yeah, from Zala Blue, that I'm worse off without it. Like, what type of blood pressure are we talking about? Are we talking like 180 over 110? Yeah, that's going to be bad. That's going to have bad outcomes much sooner rather than later. That won't be sustainable. Or are we talking about blood pressures like, hey, I used to be like 110 and now I'm sitting at like 130, almost 140 systolic. That is a totally different ballpark to be talking about. And then improvement of symptoms. Are we talking about a substantial improvement of symptoms? Are we talking about um, Colleen Carey here, where in just a few days we're feeling so much better? She didn't want to live. Now we're feeling good about ourselves. All those little intricacies matter about how we go about managing those blood pressure issues with Wellbutrin or any other medication that we prescribe. What generally what would I do about it? How high is it? If it's too high, if it's astronomically high, you gotta come off of the medicine. At least that's what I would talk to with the patient in front of me. Is you got to come off of that medicine. We got to find something else that's better for you. In context of were there previous suicidal thoughts? There are a host of different medicines to try, and if you had that good of a mental benefit from Wellbutrin, there's lots of other ones that can be just as useful. So if you need to discontinue the medication, that's often the goal. Sometimes we just cut down on the total dosage of the medication, and in a situation where we really don't want to take you off of the medicine because it's working so well, but that blood pressure is just too high to be comfortable with, then we do think about adding on a antihypertensive medicine. I personally do not like to practice that way, in the sense that it is when you start compounding medicines, when you start finding reasons to give a patient polypharmacy, multiple medications, you always are just going to increase the risk of multiple medications, multiple side effects. They all start commingling with one another, and then it can get a little hairy. That's probably a little a bit much, but I don't like putting patients in the position of having a big, large pill burden in the first place if we can help it. But yeah, I hope that helped conceptualize at least how I go after that type of a question. Let's see here. I am reading through these for just a second. Hold on. Debbie has a good point here that I started the medication over a month ago. My main side effect is an intense headache after I take it, lasting for hours. I'm just kind of curious if that headache is still persisting every single time that you take it, or was that a temporary side effect? There are two different types of side effects that people will generally have. One is a time-dependent type side effect, where you take the medication, and the longer that you take it, the more your body gets used to it, and generally the side effects will dissipate. And then there's a side effect where it's really more dose dependent, and if you take a small dose, then you're not going to get very much side effect at all. And as you increase that medication, increase that dosage, then you get more and more side effect, and they are not necessarily going to go away with time. And everybody's a little bit different. The person like Debbie, Debbie gets this headache after she takes it. Is that you could have two Debbies, basically, is what I'm getting at. The first Debbie takes the medicine. We've been on it for a month. Those headaches get less and less and less as the body gets used to it. Debbie number two might take the medication, and it's just a medicine that doesn't work well with her in terms of side effect for that, just for who she is. And that headache persists every single time that you take it, because it's dose related, and it will last for a few hours and then dissipate and go away. But then people have those moments where they have to figure out, is this headache worth it? Is the medicine giving me a good benefit as long as I can get through that headache first? Yes, every time I take it, she says. Um, so if you've been in it, if you've been on it for a month or so now, and every single time that you take it, it's probably going to be one of those medicines that continues to give you a headache every time that you take the medicine. If you haven't seen it die off a little bit. Um, I think that my wife. Let me see here if she has any comment about that. Um, but in general, when that sort of stuff happens, sometimes you can cut down on the dose, and see if that helps with the intensity of the headache. Get used to that dose, and then titrate back up to that bigger dose again, and see if that helps knock out the headache. Uh, Tubo 1812. Yeah, I hope that helps. I'm not sure if that really. I hope that answered your question, or at least gave you some framework to go talk to your doctor about it. Um, but yeah, it's not a straightforward answer. It's what's the goal? What are we trying to achieve the most? What's the most important goal for you? And what's the most important goal that your doctor wants to achieve also? I see a little bit of back and forth about the side effect of anxiety. Uh, and yes, Wellbutrin definitely can propagate a side effect of anxiety. Uh, Fairly commonly, actually, if we jump over to the side effects screen here, let's see if we can find that. Because I forget what they say specifically. Oh, by the way, when it comes to drugs.com, at the top, they generally kind of put the um, bullet point version. They I guess is supposed to be for patients at the top of bullet points of, hey, more common, less common, rare side effects, just so it's easy to read. But honestly, it's kind of interesting. I think it's really for healthcare professionals. I don't know. I think it's good to see like the percentages next to those side effects, of like how likely or unlikely is a certain side effect likely to happen to you. But let's see here as far as anxiety. I mean, yeah, anxiety, confusion, decreased libido, increased libido, memory impairment. All of these here are considered common, somewhere between 1 and 10%. 1 and 10%. Now, I admit, you see up here in the very common section, it says agitation up to 31.9%. I mean, you're talking almost a third of people that take this medication will feel slightly agitated. What does agitated mean versus just an increase in feeling anxiety? I don't really know. I don't I don't know where that line gets drawn. But very, very common to see patients say, I just feel like I am shaking and quivering all the time on this medicine, and I feel like I just can't slow my brain down. Um, but out of experience, then um, I can tell you that there's been plenty of patients where other SNRI medications are not super effective. They have generally a more anxious, um, they have more of an anxious presentation, a combination of anxiety and depression, but the anxiety really seems to drive them. We're kind of out of options of trying things, and so we go with Wellbutrin. There's been a handful of times Wellbutrin really seems to calm them down, and works really, really well for those patients. But you do have to be careful with it. If you are somebody who's on the anxious side, yeah, it can absolutely continue to drive the anxiety through the roof. Do you think it could be similar to the anxiety from Adderall? Do you think it could be similar to anxiety from Adderall if it's less than that, I know I'd be okay since I've already experienced that. So if I'm what it really comes down to there is you're talking about two different medications. And so they're two different types of mechanisms of action. And ultimately, you're going to get two different side effect profiles. Uh, what is intense for you of anxiety from Adderall might be really mild to somebody else, and vice versa with Wellbutrin. So it's really hard to judge anxiety on Adderall and compare that to the potential anxiety from Wellbutrin. That's generally a trial a trial and error type thing that you have to unfortunately have to go through, because you might not get any side effect of anxiety with Wellbutrin. You might feel you might get exactly the type of effect that you're looking for. Wife, what did you say? Agitation can have more of an irritability presentation where we're walking on eggshells around others and quick to react. Yeah, Allie's talking about the difference between agitation and anxiety there. But yeah, what's Carrie? Yeah, I hope that answered your question. Two totally different medications. So yeah, you just got to do some trial and error. They're not they're not necessarily comparable, but yeah, you can definitely get anxiety with both those types of medications. Yeah, I don't really have anything else as far as any comments to go based off of. Um, I really appreciate a few of you jumping on and asking questions, and I want to continue to do that because, again, these are a lot of common questions that I see with people in clinic. Uh, my wife being a psychiatrist, me being family practice, urgent care, they there's a lot of commonalities there. We see it all in all those different clinics, and I know that it's sometimes hard to get into the clinic and then you're trying to express what you're feeling to the physician, but they don't really have time, and you sit there and you talk for 5 minutes. You don't really get out what you feel like you need to talk about. This guy, this prescriber is telling you what they think that is going to help you best in the moment, and then they're off. So I want to continue to do this to try to give you a second or some time to ask questions, and get at least my perspective on how I generally try to help patients through those experiences. Because being being in the urgent care, I do tend to not try to mess with those medicines. I mean, unless there's a very serious reason why we got to change the medicine, or stop a medicine or discontinue a medicine. I really don't mess with those medicines very much, and I do try to coach that patient on how to approach their own provider regarding side effects and benefit. And is this a good medication for you? Is this not? Um, so next Tuesday, I'm going to do the same thing. Tuesday at 12. I'm going to talk about Wellbutrin. We're going to do Wellbutrin. We're going to do Buspar comments and questions. And so leave some comments and questions on the Buspar video, or show up live and then ask your questions there. I'm going to try to take those questions again, just like we did today. And yeah, I hope that was helpful, and I hope you all have a good day.